Okay, I think I'm recording, and I am going to be giving a lecture on gastrointestinal disorders. And I have Kate and Alia here that are going to talk to us, and share some of their history of two different disorders. So, Alia, you want to go first? Can you tell me about yourself, like introduce yourself, and just tell me about your diagnosis and all?
My name's Alia. I am 26 years old, and I have celiac disease, as well as mixed connective tissue disease, so a variety of autoimmune diseases that go along with celiac disease. I was diagnosed in college freshman year, 2011. I went through a very series of tests and appointments, various doctors and hospitals, and ended up having a colonoscopy and endoscopy and positive blood work that indicated I had an autoimmune disease, and specifically celiac disease as well. It was a very long process to go through a definitive diagnosis, a lot of, differential diagnoses, and I ultimately ended up getting my final diagnosis at the Cleveland Clinic. So.
And Kate, why don't you jump in here and tell us about your disorder? I know that's a little different than I just said, but I like to change things up.
Okay.
Tell us a little bit about yourself and how you were diagnosed.
Okay. Hi, my name's Kate. I'm 22, and I have Crohn's disease, and I was diagnosed when I was 15 or 16. I definitely started getting symptoms around 14 or 15, and I was diagnosed when I was around 15 or 16. And it was honestly my mom who really started to notice that, like, I was really low energy because I was losing a lot of blood. And I didn't tell her about my symptoms or anything about that. And we actually ended up going on vacation together. And she ended up figuring out that I was like really, really sick, because the entire time that we were on vacation, I was just asleep in the room. And she thought that I was staying up all night, like typical teenager. But no, I was just really anemic. And so I ended up getting diagnosed with colitis first. And it took them like a year or two to find out that I had Crohn's. And now they're like being like, oh, you have more ulcerative colitis symptoms. So it's something that jumps around a lot. And, it's just one of those things.
Kate, what would you say is the difference, or do you know the difference between ulcerative colitis and Crohn's? Because I think that is a pretty common. It sounds like it's almost confusing to your practitioners.
Usually it's like the locality. Like ulcerative colitis is usually like to the ileum to the rectum, I believe, and Crohn's disease is all the way from the mouth to the rectum. So I originally was diagnosed with Crohn's, but recently my doctor hasn't really been seeing as many Crohn's symptoms as like ulcerative colitis. Like my most recent colonoscopy, because I have a colonoscopy like every single year, actually was showing like a lot of inflammation, like more towards like the ileum area, and there was like a little bit different symptoms. But it's also kind of hard because with these sort of diseases, you do jump back and forth, and they are hard to pinpoint. But yeah, and definitely an experience.
Yeah, Alia, you had said that I think your definitive diagnosis took a couple of years, even, right? Mm-hmm. Can you tell me a little bit about how having celiac has affected your life?
It's been overwhelming. Even having been diagnosed, or I guess you could say early on in college, there wasn't a whole lot of gluten-free options back then. So aside from obviously being malnourished going through college, there wasn't a whole lot of food options, especially Kentucky. So that was a really hard adjustment for me. And then coming out of college, kind of living on your own and trying to figure out your new job and eating habits, it's kind of hard to say like, oh, do I pack lunch this morning, or do I try and risk it and go out and find something to eat that won't kill me? And I think the biggest impact that it's had is the emotional effect on you. It's very hard to say, you never know when you're going to wake up and not feel good, because autoimmune diseases are just so complex that doctors don't really have a definitive way on how to treat you, and you can be eating gluten-free for however long, but still have, for example, like leaky gut is a thing that I've been told. And so trying to adjust to, I guess, my eating habits better, structuring my day around when I can eat something safely without being contaminated or cross-contaminated is something that's been kind of hard.
Kate, what about you? Is there any emotional component in your diagnosis, or how it has affected your life?
Oh, definitely. First of all, it's a disease. I feel like Alia probably understands this really well too, that it's kind of embarrassing to tell people, especially with the symptoms that you have. So like, sometimes you can't just be like, oh, I really don't feel well because I'm anemic because, I'm defecating blood all the time, and a lot of people don't understand like the seriousness of the situation. I feel like Alia also feels that way a lot because especially with her gluten-free diet, it's not just she's gluten-free because it's a fad or anything like that. So I feel like people's reactions can sometimes be difficult. Like my boyfriend himself is a biologist and he's studied immunology. He studied Crohn's disease as like a project and like he understands it. But I think it's different to understand the actual aspects and to understand the human factor that actually exists along with a disease. Mm-hmm. And emotionally, it can be really taxing because you can feel like you don't have energy for anything. And like, especially if you're in stages of anemia and like it's just like if you want to go on a trip, you have to bring all your medications. And even if you do take all your medications, and even if you're watching what you eat, even if you're doing what you're supposed to, you can still get sick randomly. And then what ends up happening is like if you're on vacation, you don't know what to do. And it's hard to do things that you feel like normal people should be able to.
It's the flares, the unknown flares that come up that are just like, why? I'm doing everything right. I'm sleeping. I'm not eating out, or, I'm trying to get as much rest as possible. I'm taking my meds on time. I have vitamins. I'm like everything, staying hydrated. And then the flare happens and you're just like, why is this happening? And you just shut down emotionally and physically.
Sounds a little frustrating and almost a inability to control part of your life, big part of your life.
Definitely.
Mm-hmm. Yeah. What would you guys say, I think it's easy for me to teach, not easy, but it's easier to teach nursing students about the physiological changes of what's going on with Crohn's or celiac. But I think the hardest part, at least it feels to me the hardest part, is to teach them that human factor, Kate, that you were talking about, and Alia, the emotional piece of it. So, I don't know if you all have any advice or anything specific that you would tell. These are brand new. They're second semester nursing students. Some of them are going to graduate in December. I don't know, honestly, their exposure to people with Crohn's and celiac to date. But we're going to be talking about it on Monday. And I just thought it might be very helpful to them to hear from you two on maybe good experiences, bad experiences, how you would recommend them treating someone and remembering the emotional and the human side of it.
Mm-hmm. Who wants to go first, you or me, Kate?
First, Alia.
So I think nurses are in a unique position to really understand a patient and their patient history and gather all the information that is needed to provide the doctor the most relevant information to treat the patient at the time, given their current symptoms and flares. Especially being hospitalized, your nurse is the one that's going to be there quicker or, more responsive than the doctor, who it might be wandering the halls and checking on other patients, or your case manager and things like that. So the nurse, I think, the compassion that I've experienced with nurses has been overwhelming and definitely very helpful when you're going through something like that. And I think that because doctors, it seems like these days, are so focused on seeing the patient and then getting them out the door and then seeing the next one, it's really, nurses are really vital to a patient's overall treatment plan.
Kate?
Well, oftentimes I feel like nurses are the ones that you like really listen to you, and they're the ones that really, really like write down what you have. They really think about what you have. And like the doctor spends like maybe 5 minutes with you, as opposed to the nurse who like really listens to like your problems and then they relay it to the doctor. So a nurse's role is really crucial, not only in the fact that they're empathetic, and I've had really, really positive experiences with nurses, and I've had pretty positive experiences with doctors, but comparisonly, like in a comparison, like nurses are definitely higher. But just like they have so much power that they don't really quite realize is that if they like really listen to us and they really think about it, and like chronic fatigue is a huge problem that they tend to write off because they're just like, oh, it's just part of your like disease. Like you should be able to micromanage it or whatever. But it really does affect your quality of life. And when they really think about it from a human aspect, and when they really try to empathize and they really try to understand what it's like to be chronically fatigued, and then they relate that to the doctor, you can actually come up with like solutions that are a lot newer and a lot more exciting for us, because it shows us like some way to see the future in like a more positive light.
Mm-hmm.
And I think it also provides other resources like occupational therapy and physical therapy. Your nurse is the one who's monitoring you mostly when you're in the hospital, like in my last experience that I had, and having the occupational therapist come in and read through my my history and my admission through the course of 3 days, and then work with the occupational therapist and like how can we help her adjust back into her normal routine in life, and how can we alleviate the stress that is induced in having a chronic illness or gastrointestinal disease.
Mm-hmm. Anything either one of you would like to say in closing?
You go first.
Okay. Just keep in mind that the people that you work with, we have odd illnesses, and each one of us deals with it differently. And especially, like, I was diagnosed when I was 15. I was at a very, very fragile state of my life, and I was put on steroids. So Crohn's disease obviously makes you lose weight immensely. So I lost like 30 pounds, and then I gained back like 40 because I got put on steroids. So I have like nasty stretch marks and all that stuff. And like as an adult, I'm like, well, everyone has stretch marks. It's not a big deal. But as a teenager, you really have to like be sensitive and be caring and do the best that you can, just because like it's a very sensitive time of their life. And I think that that's the most important thing I can say is just like that patience and that understanding, especially with people who are younger.
Definitely.
Mm-hmm. I would have to say that nurses are definitely, they should seize the opportunity that they have to really bond with the patient and be that compassionate person in their treatment plan. And going through a diagnosis freshman year of college too, I'm just like,
oof, yeah.
It was very difficult, and having that support system was very important to me. So yeah.
Thank you, ladies, very much. You're pretty amazing people, and I really appreciate you being open and talking to my students. And I think that they will get some insight on two diseases that I think are really important for them to get a good handle on.
Thank you.
You.